question has been brought up is, does the motion have to be active motion or passive motion or both, and what's more effective? Okay? I do not use active motion by the patient ever. And there's a very good reason for that. Number one, it's very difficult to explain to a person how to externally rotate their hip. Number two, we talked the whole weekend about the neuromuscular barrier. The neuromuscular barrier being the neural drive to a tissue which is prematurely stopping the end range of motion from being reached. We also said that an abnormal palpation finding of tension is tension palpated within the normal range of motion of a particular articulation. If you actively move the joint, you will automatically prematurely restrict that articulation's range of motion because you are purposefully increasing neural drive to the tissue. So even when we're working passively, we need to use techniques like pails to get past that neuromuscular barrier. If you're actively asking them to contract their muscle, you will most definitely run into that neuromuscular barrier, and there's no way you'll be able to fully release that tissue to the extent that we want to release it. Now some people will say, well, that's not true, because if I'm activating my extensor group, then I'm inhibiting my flexor group because of reciprocal inhibition. But as we talked about yesterday, the theory of, or the occurrence of reciprocal inhibition has been proven to be false for many, many, many years now. So when you're extending with your extensor group, you are definitely getting contraction in your flexor group. Be it an eccentric contraction, you're getting contraction. So you're increasing neural drive to the tissue, you're activating spindles, and you're prematurely blocking that range of motion. Especially if the person has no control over the range of motion you're trying to treat. One of the beautiful things about FR and the FR system is that utilizing PALS and then functional range conditioning, we're going to improve their functional range of motion. So we'll teach the nervous system how to utilize the newly acquired ranges. But if you're treating someone who has never done that type of training, and they don't have control over the ranges that you're trying to treat, but yet you're telling them to actively get there, there's no way they're going to get there. So you're only going to be dealing with the fascia in that very small arc of motion as opposed to getting right into the end ranges of that fascial restriction. So for that reason, active range of motion would be far less effective than passive range of motion. Even though active range of motion has some merit in that it can decrease pain, because during movement people feel less pain, it hinders the movement far too much to be beneficial when you're trying to do a release technique. Any questions?